Everyone, happy Tuesday evening and welcome to our Q&A session, our post World Voice Day follow-up event. People are still joining right now, so we'll give everyone a couple of minutes to get signed on. FYI, we are recording this event tonight, so in case you missed something or you want to go back and listen to more of the questions, you'll receive the recording in an email. If you are seeing a screen with a lot of different black boxes on it with names, if you right click on your mouse, you can select hide non-video participants. That way you'll only see the panel as we talk and you won't have a whole bunch of people popping up on there. We will be communicating tonight via the chat box. So if you have questions or comments that come up as we're going along, feel free to send them to us in the chat. I'll be monitoring that as closely as I can while we're discussing things. We also have questions that people have submitted as they've registered for this evening. And we have questions that people submitted after the World Voice Day event. And we have some questions that come up a lot with our other events that are probably relevant to this audience as well. There has been a question already about seeing the recording of the World Voice Day event. That we can definitely send out. In fact, it was in the invite email that you got to notify you about this event. So if you got that invitation email from worldvoiceday@duke.edu, there's a link in there to the recording of the World Voice Day presentation. So check that. If you have not received that, then go ahead and email worldvoiceday@duke.edu and say, hey, can I get a recording to the World Voice Day presentation? And we'll send it right out to you, okay? All right, so thank you again for everyone for joining us on another weekday evening. I know it's not always easy to do that. We're excited to have the opportunity to provide more information and have a good discussion about all things vocal health, performance anxiety, how the voice works, why it works, and what we can do about it when it stops working as well. So it's hard in the digital age and the era of Zoom meetings to cram everything into a evening presentation. And we always wish there was more time to do some question and answers. So there were a lot of great questions that came through on World Voice Day. We thought, hey, why not extend this a little bit and give everyone an opportunity to get their burning questions answered. We love talking about voice stuff. We love talking about all of this and have a hard time stopping, even outside of work. So we're glad that you're here to be voice nerds along with us, and hopefully we can answer your questions and we can have some fun. So I'm going to have the panel introduce themselves, and then we will begin.
Hi, everybody. My name is Leda Scearce. I am a singer and singing teacher and speech pathologist, and I direct the Performing Voice program at Duke Voice Care Center, where I primarily work with singers who are having voice problems.
I can go next. So I'm Dr. Alissa Collins. I'm a laryngologist at Duke, and I work very closely with these fantastic speech language pathologists to take care of our patients with voice concerns. I'm excited you guys are here.
Good evening, everyone. My name is Ingela Onstad, and I am a board-certified coach. I'm a licensed psychotherapist, and I also happen to be a singer and former voice teacher as well. And my specialty is working with performing artists and other professionals who find themselves in the public eye on matters of anxiety management and performance, stage fright, performance anxiety, etc. So I am here to answer any questions that any of you have about the mental and emotional health side of performing and singing tonight.
And I am Lauren Fay, also a speech language pathologist, voice therapist at the Duke Voice Care Center. I see mostly non-singers. I see a lot of people with problems with hoarseness with speaking, chronic cough, throat clearing, throat pain, trouble breathing, things along that line. And I'll be moderating tonight and fielding questions as they come in. So if there's anything that crops up, let us know. I think we'll start with a question that has come up a lot and was discussed or was brought up during World Voice Day. And the general question is, over time, my voice has changed, especially when I'm singing. And I notice that it's not as strong as it used to be. It's a little weaker. I can't sustain a pitch the same way I used to be able to. It wavers a bit more. Why is my voice changing over time? So I thought this would be a good opportunity for Dr. Collins to start us off.
Thanks, Lauren. That's a fantastic question. There's not one single answer to this. And so speaking from the medical physiologic side of this, with aging, you know, our voice is made up of muscles, and our vocal cords are made up of muscles. And so with aging, just like other muscles in our body have changes, so can our vocal cords undergo changes. So they can get thinner. So while the vocal cords should close completely while we're singing and speaking, they may not close as well as we get older. They can lose some of their pliability, so they make them get a little bit more floppy than they were when we were younger. So that's the voice box part. The other part that's critical to making your voice is your breath. And we know that with aging, normal physiologic changes in the absence of underlying lung problems like asthma or COPD, those types of things, changes in your lungs can alter your breath support for your voice. So those two things together, I would say probably account for the biggest changes that people notice. Of course, there are other factors, but those are the big physiologic ones as well.
And then to follow up with that, Leda, I'm curious if there are some strategies that you would offer to help someone with a voice that has started to change over time. What kinds of things seem to be helpful for that population?
Thanks, Lauren. Yeah, there's a real use it or lose it principle at work here. And so I think the number one thing is continue to exercise your voice, continue to sing. A lot of times what we see with our older patients is they may have been more active singers, they may have been performing a lot, and as they get older, they're just not performing as much, and it becomes much more intermittent and not necessarily keeping up with the practice in between those performances. So it's very, very important to continue to have a regular vocal exercise regimen and continue to work on your voice. If that's something you've done and you're still struggling, it's not unusual, as Dr. Collins said, for there to be changes that impact just how our voice is functioning. And so the same technical gesture may not have the same result as it did 20 or 30 years ago. So it's a good idea to get somebody to help you out with that. And that's where coming in to see a voice specialized clinic is a great idea, to see a laryngologist, to make sure there's not anything structural that's concerning that needs medical or surgical attention, and then also a voice qualified speech pathologist, ideally a speech pathologist who works with singers, to kind of help you reestablish that exercise regimen that aligns well with where your voice is now.
Absolutely, thank you. And this is a population that we see a lot of. So if you're experiencing that, you're certainly not alone. And we have tools that can help, as Leda suggested. Ingela, a question for you related to that. Someone mentioned feeling a bit more nervous when they have a performance coming up and they haven't sung in a while. They're not exactly certain about how the voice is going to come out, not sure how to prepare themselves for that performance and feel confident going into it. Do you have any tips for that?
Sure, Lauren. And actually, I would like to just speak on the aging issue as well, because I occasionally also work with clients who are dealing with what I might call identity issues with their voice, right? We go through different phases and stages of life, and we're showing up as performers in different ways through different stages of life. And oftentimes, I think one of the most helpful things we can do is to show ourselves a lot of love and empathy for what it is that we are going through, and to accept that change does happen, and then to also encourage ourselves to be proactive in getting help and support in these issues. I personally find it very tragic when I am working with clients who have been struggling with something for a long time for which there would be help for, but they haven't accessed resources because they've, I don't know, put themselves at the bottom of their to-do lists, or thought, oh, what does it really matter? It's not all that important after all. But as for a singer who maybe hasn't been performing for a while and then is going back onto stage or into some sort of performing opportunity, this can also happen if we're performing regularly, by the way, right? Nerves or stage fright, performance anxiety, whatever we would like to call it, can really strike us at any time. And I find what a lot of folks want to do in that situation is they want to try to figure out the reason why they feel that way. And while that can be sometimes helpful or calming and give us some insight, what I would rather encourage people to do is to ask themselves this question instead: how can I help myself through this difficult time? How can I help support myself when I'm feeling nervous? I'll tell you, the first thing that absolutely does not work is to tell yourself not to feel a certain way. That one never works, folks. Last time you were getting angry and somebody told you to calm down, did that help you feel any calmer? Heck no, we all know about that. So if you're feeling anxious, once again, it's about that piece of empathy that we can understand and normalize, that feeling anxious about something that we care about, something that we have put time and energy into, is very, very normal. It is also incredibly normal, of course, to feel anxious or nervous when we are standing in front of a crowd, right? When we have a lot of eyes on us, something happens biologically. If there was an animal in the room, let's say just a common house animal like a cat or a dog, and everybody in the party turned around and stared at the animal real quick, what would the animal do? Probably their hackles would raise, or they would hunch over, they would make themselves small. So it's very natural for us to feel alarmed in these situations. There are many, many different things we could focus on for calming in this situation. But I think what you want to do is you want to be looking for calming strategies that you can use on a more regular basis, like engaging in some type of journaling or meditation or mindfulness or prayer, some positive affirmations, a calming breath practice that you are using on a more regular basis, so that when you are feeling really nervous before stepping out onto stage, you're going to remember those tools in your toolkit.
Wonderful, thank you. We had a question just come in through the chat here, saying several of my students who have had COVID are complaining of residual scratchiness despite consistent practicing and vocal workouts. One student in particular has lost a fifth. This has caused significant anxiety for them and leads to some additional tension. Looking for any feedback for relaxation techniques. This person who's asking is also a licensed psychotherapist. So they have a solid repertoire for teens, but would love any additional tools specific to these high performance musicians. Ingela, if you want to start out with that one, and then maybe Leda can add some thoughts as well.
Sure. To the person who is asking, since you are a therapist as well, you I'm sure have a lot of great tools in your toolkit already. One thing, and maybe one of the first areas I start with my clients that I work with, is on the area of breath. And I think I might have walked through this in the World Voice Day presentation as well. But a really great one is to make sure that we're encouraging people to get their nervous system into a calmer state before singing. Now, I understand, or I have full empathy for the fact that if a student or a person has had COVID and they are feeling very anxious about their voice, that might be really hard to do. So I think there are two different calming strategies that we could look towards, and I find some work better with some clients and some work better with other clients. So I'll take the sort of typical calming breath strategy first. That would just be to encourage folks to take in a really easy inhale through their nose, and then to hiss like a snake, or to blow like we're blowing out through a small straw, to blow out the exhale. We're looking for a ratio that is 1 part inhale to at least 2 parts exhale. So this is sometimes also referred to as a double exhale breath. Just according to the way that we are built, it's kind of a magical thing when we have an exhale that is at least twice as long as our inhale. It stimulates the vagus nerve, which is responsible for calming our system and activating the parasympathetic response. So something like an extended exhale breath can work really well. But occasionally I have clients who say, well, when I'm feeling very anxious and activated in my nervous system, I have a hard time employing any calming strategies. And so for those clients, I actually suggest strategies that help us do what's called completing the stress cycle. So that can be something really silly. You can feel free to laugh at me right now. I will demonstrate it. I better take my ring off because sometimes it goes flying across the room, where we just kind of shake out our bodies. I would encourage people to stand up while doing this, just right? If we've got a lot of that nervous energy built up in us, sometimes we need a release for it. So we need to do something very active. And then we feel, in fact, I was just doing this with a client earlier today. We both shook like lunatics for about 30 seconds on screen. And afterwards, it was very interesting. We had to laugh. We both went like this. So it was just this automatic calming response that we both experienced. So those might be 2 pretty quick and simple tips that you could try to employ with those folks.
Thank you, Ingela. Before I say anything about this, as I'm looking at this question from our friend Becky Jorgensen, friend of Duke Voice Care Center. Hi, Becky. I'm zooming in on this part that says residual scratchiness and loss of range. So I would like to pitch this over to Dr. Collins before I say anything, because that jumps out at me.
Thank you for pitching it over to me. I was going to butt in at some point before we moved on to the next question. So I think that's a really good point, Leda. And so I think as I caught the first part of the question, it said this was post-COVID, post-COVID people. And so I would say, this is not uncommon we've seen a lot of folks post-COVID with persistent throat irritation, but just post-viral illness in general, right? Whether that's a bad cold, flu, anything like that can leave you with a persistent scratchy sensation in your throat. My kind of rule is I give folks like 2 weeks of kind of this like get over the virus kind of thing. But if that persists beyond that, I think it's worth coming in and letting us take a look, especially people who are struggling, right? Because I love all the ideas, Ingela, for all the calming and relaxation. But if there's something structural or that we need to kind of identify that's in the larynx, whether it could be something down there from all the irritation from coughing from COVID, right? Or I've seen a lot of folks who have more postnasal drip post-COVID who've never had postnasal drips. There could be a medical reason that's contributing to this. And I think that we should definitely rule that out, just make sure that everything is nice and healthy, but it's not uncommon for these patients to have persistent irritation. And we've seen it a lot.
Thanks, Dr. Collins. And I'll just piggyback on that a little bit and say it's really important if you yourself are experiencing these kind of voice changes, or if you have students or friends who are, when you have somebody look at your vocal cords, it's really important that they use equipment called video laryngostroboscopy, or we just call it a strobe for shorthand. There are different ways of looking at the vocal cords, and different clinics might have different types of equipment, and this is really sort of the gold standard for identifying vocal cord problems, because we get a really detailed picture and we can see what happens when the vocal cords are vibrating. So that's a really important piece of that assessment that happens afterwards. If that exam has taken place and there's not anything structural going on, and that person has great vocal hygiene, they're drinking plenty of water, they're not clearing their throat, they have all these good habits we talked about in our previous World Voice Day presentation, then I think it's probably a good idea for that person to get some voice therapy, again with a speech pathologist who's a voice specialist, and ideally a singing voice specialist. To me, I love when that happens right alongside the voice teacher. I rarely recommend that people stop voice lessons while they're doing voice therapy. And I think having a collaborative process between the laryngologist and the speech pathologist and the singing teacher, all kind of focused on getting that singer back on track. But you're definitely right that's not a normal thing to lose that kind of range or have that kind of voice quality change last for that long.
And I like what you mentioned there too, Leda, about having voice lessons simultaneously occurring with voice therapy. And I wonder, Ingela, if you could talk a little bit about how what you would do in coaching someone with performance anxiety might align with someone who's going through voice therapy at the same time, kind of what would be different or how you would collaborate in that setting.
Yeah, and I do have some SLPs that refer patients to me for whom traditional therapy perhaps is not quite the ticket at that moment for whatever reason, probably having much to do with the fact that I, as a singer, have a special deep kind of empathy for what somebody is going through when they are having vocal issues. But I think what's happening is oftentimes here in the Western world, we tend to sort of separate ourselves out into pieces. Oh, well, I'm having a problem here, and so I'm just going to focus on what's happening here. But of course, if I were having vocal problems, and I have had them in the past and have had to seek expert care as well, this is going to very deeply be affecting us in our minds and also in our bodies and our emotions, right? So we cannot separate out one part of us and just hyper focus on that. It's going to have a domino effect throughout our being. So if nothing else, I would really encourage people to be extra gentle with themselves at a time like this when they are experiencing some difficulties. I find that a lot of clients I work with in these situations, they tend to hyper focus, or we might call that overthink what's going on, where I have a client working through some, on the tail end of some voice issues right now who's back to performing. And when I speak to this client, she and I work through a lot of, progressive muscle relaxation strategies to help her stop the patterns of overthinking about what's been going on with her body. Because as we all know, if we are very anxious in our brains, that anxiety is going to manifest in our bodies as well, and in our throats, of course. So I think it's just important to take care of ourselves from a very well-rounded perspective, and to make sure that we're watching out for our heart and our head, as well as all of the different body parts and systems.
And speaking of how these systems go together, actually, we'll go over to Leda. It looks like she had something to add. Go ahead.
A little quick follow-up, because I just realized there was one part of Becky's question that didn't get answered, where she was talking about specifically muscle tension. I think all of the things that Ingela has brought up, just kind of in terms of focus and relaxation techniques, are so important for that. Sometimes muscles are just tight and that tightness needs to be directly addressed. And there is a technique of manual therapy. Sometimes it's called myofascial release. Sometimes it's just called manual therapy. And so seeking out a provider who has that training, whether that is a physical therapist or a speech pathologist who has that manual therapy background, that is kind of directly working on these areas of tension, can be super beneficial too.
And so as we're thinking about how the voice and the body interact, I wonder, Dr. Collins, if you could comment on the ways that things like Hashimoto's thyroiditis or snoring or TMJ dysfunction might impact how the voice functions.
Thanks, Lauren. So I'm going to separate those out, because it's going to be different for each of those. So taking the Hashimoto's, it's interesting. There's been literature evidence that when thyroid disease, Hashimoto's, is not controlled, that it's thought that there is deposition of some proteins in the vibratory layer of the vocal cord, which can lead to increased bulk of the vocal cord and lowering of the pitch. So you can have hoarseness and kind of a lower pitched voice, especially in women. But the overwhelming majority of people, the literature review that I've done recently doesn't really, it's hard to identify kind of at how off your thyroid has to be before you're going to have, thyroid problems. So there are a lot of people who have Hashimoto's who don't ever have voice concerns, but it's always something we think about, right? So, and that's something I always check when I see a patient who has thyroid disease is, are their labs within the normal range? So for Hashimoto's, it's extra bulk to the vocal cords and typically lowering of the pitch for women. For TMJ or temporomandibular joint disorders, that can be kind of, there's a spectrum of disease there that can just be periodic joint inflammation, which can cause a variety of symptoms, some of which manifest in the voice potentially, but leading to facial pain, limiting your mouth opening, either from structural limitation, from just mechanical, like they just can't open, or it's pain limited. And that can really have a significant impact on, not directly on the larynx, but on how the voice comes out, because the mouth and throat are your resonating chambers. And if you're not able to open your mouth and as you normally would, that can have an impact on your voice and communication. And the last one, Lauren, what was that one again? Remind me.
Snoring and vocal health.
Snoring. Yeah. So I saw that question come through the chat. And so I think it's really important when we talk about snoring is, do we have just benign snoring? So you're just snoring, but you don't have sleep apnea, or is this snoring the tip of the iceberg and there's some sleep apnea under there? Because I think the potential implications on the physical health are different. The only way to differentiate the two is to get a sleep study. And this is way more than we need for this setting, but that's how you would differentiate the two. But in snoring, for most people, that is a vibration of the soft palate in the throat with sleep. And benign snoring, it can be a little bit irritating and maybe some dryness to the larynx and the throat, because often with snoring there's mouth breathing, so that can have an impact on your voice. So that's benign snoring, no sleep apnea. Sleep apnea, same thing, you still hear the snoring, there's probably some mouth breathing, but also there's obstruction. The tissues are actually collapsing on themselves and airflow is obstructed down into your lungs, and that can be pretty irritating. And I found a number of my patients who have kind of an irritated voice box. If there's an untreated sleep apnea component, it can absolutely contribute to that. And again, the dryness is another big part. So again, snoring, two parts: benign snoring, sleep apnea. Sleep study is how you differentiate that. And if you have sleep apnea, that should be treated with either CPAP surgery or other things.
And we had a question come through talking about teeth clenching. Could you talk a little bit about the difference between clenching your teeth versus TMJ dysfunction?
Yes, I can. I'm not a qualified dentist or an oral surgeon, so I will give you that. I'll put that disclaimer out there. But so teeth clenching, there's kind of two times that you clench. We can clench during daytime. It's stress, right? Sometimes we just sit there with our teeth clenched, but there's also clenching that can happen at night, and that's not something that we're aware of. So there's some strategies that you can work through to not clench during the day, such as putting your tongue behind your teeth and kind of keeping a little space between your upper and lower teeth. At nighttime, that usually requires a guard to kind of keep your teeth from clenching. The consequence of all of that is the clenching is being caused by isometric muscle contraction. And so as that muscle is clenching consistently, it can cause pain, soreness, and it can function in the same way as if you almost had temporomandibular joint disorder, because it can cause soreness and it can impact your resonance as well, and pain.
And I'll pop in here too and talk about, how pain is going to be affecting us. Once again, it comes back to what I mentioned earlier about oftentimes issues of hyper focusing or overthinking on some topics. And then also things that happen to us in our experience here in this human body, in this life, that can really cause us to maybe have a little bit of issues of identity once again. So if we have been thinking of ourselves as a healthy person and then suddenly something happens, this can really shake us on some deeper existential levels. Not to mention, if we are in some type of chronic pain or having some type of chronic issue vocally, of course, that can lead to us hyperfixating on this thing. It's like we are taking the whole entire spectrum of our attention and putting, one giant powerful beam of our attention onto this one problem that is happening. So oftentimes, being able to work through what we call some cognitive behavioral therapy strategies. Cognitive behavioral therapy is a modality of psychotherapy that deals exclusively or primarily with the link between how our thoughts impact our emotions and our behaviors, which then of course turn around and impact our thoughts again. So it can be helpful, and actually I believe they've done some research on this to show some pain relief possibilities as well, that if we are able to think about our pain differently, we can provoke less of a pain response in the body. So we have to really, this can take a while, and this might need some professional help as well, but becoming more aware of the types of thoughts we are having around ourselves and our pain, then addressing whether we think these types of thoughts that we are having are helpful or hurtful. Little secret here, 90% of the time, they're probably kind of hurtful or harmful thoughts. The way we're speaking to ourselves about this issue is not necessarily helping us. In fact, it might be adding to our emotional pain at the very least. And then finding a way to stop or interrupt those thought patterns and replace them with something more helpful. Perhaps we learn to say to ourselves, this is difficult right now, but I'm getting support and I will get through it. Or although my pain is high right now, it's something that I can handle, etc. So we use then the mind to help support some of the experiences that are happening in the physical body.
Awesome. Yeah, it's a complicated instrument. One of the other questions that we get a lot, you may have heard us mention things like forward resonance or feeling vibrations in the face with regards to techniques we might use when singing or in voice therapy. And Leda, this might be a good chance to talk a bit about that, some of the things that we do to help people who are experiencing some of these problems.
Sure. So quick sidebar, all instruments have three basic components in common: something that drives the sound or energizes the sound, something that vibrates, and a resonator that shapes and filters the sound. In the case of the voice, what's powering the sound is air from your lungs. What's vibrating is your vocal cords opening and closing. And the resonator for the voice is pretty much everything between your vocal cords, which are about right here, and your lips here. So throat cavity, mouth cavity, sometimes even the nose cavity. What's unusual about the voice as an instrument is that we can change the shape of that resonator in really an infinite number of ways, because we can move our lips, our tongue, our jaw, our palate, the walls of the throat, and all of that changes the shape of that resonator between the vocal cords and the lips. So all that to say that we can change the shape of our resonator in a way that actually makes the vocal cords vibrate more efficiently, makes the voice sound better, and requires less effort. Or we can change the shape of the resonator in such a way that it actually undermines how well the vocal cords are vibrating and undermines the sound of the voice and makes it more effortful. And that can happen regardless of any structural problem. So that can happen in complete absence of any structural anomalies with the system. So when we achieve resonance, a lot of times people describe a sensation of buzzing or vibration, usually somewhere in the mouth or face. Not always. Everybody experiences this in a slightly different way, but that's a thing that people notice a lot. So I think we've got a really experienced audience here, but you probably all know that humming, that really enhances that buzzy sensation that we feel. And so working on getting that optimal resonant sensation to happen as much of the time as we can really improve how your voice is working. Now, the challenge with singing is that that resonant sensation is going to be different depending on where you're singing in your range, depending on what kind of singing you're doing. So the way resonance feels for a classical singer can be quite different from the way resonance feels for somebody who belts, and so on and so on. Identifying kind of what are the sensations you're experiencing when things feel free and easy, and when you like the sound, and trying to cultivate that coordination. Now, to me, I feel like any kind of motor activity, whether it's swinging a golf club or singing or playing the piano, I feel like all of those kind of motor skills really benefit from instruction and teaching with an experienced and accomplished teacher. So I always encourage people, if you want to improve your voice, work on finding a teacher who's a good fit for you and helps you kind of carry your voice forward. That was a long answer, but hopefully got at that question of resonance a little bit.
I think so. Thank you. And if anyone has any follow-up questions about that, feel free to add them in the chat. Here's a follow-up question. What were the 3 components of the instrument again? Would you mind, Leda, going through that one more time?
Not at all. Sometimes I go through these components in my dreams. Power, the energy of the sound, something that vibrates. Sometimes we call that the source of the sound, and the resonator. So power, source, resonator. So in a guitar, what's powering the sound is the arm and hands of the player strumming or plucking the strings. What vibrates is the string, but it doesn't sound like a guitar if you just take the string off and pluck it, right? It takes that resonator, that wooden box of the guitar, to make it sound like a guitar.
And so a question for Dr. Collins here. When someone is experiencing voice problems, they're wondering when you should go on vocal rest. When would that be a reasonable recommendation?
That's a good question. That's a tough one. And I'm going to tell you, I don't know that there is any kind of evidence-based recommendation here, that just being completely transparent. I think it's important to understand what's going on, right? So, I mean, I'm thinking of a wide variety of vocal pathologies, right? Do you just have a cold and it's just a cold, or did you have COVID and you were in the hospital and you're, had a breathing tube in and now you're hoarse, right? Those are very opposite ends of the spectrum. I think, how do I want to answer this question? I think if you're wondering whether you should go on vocal rest, that tells me that you are quite concerned about the voice, right? And I think it is worth, getting an evaluation with somebody before putting yourself on voice rest, because we don't know that voice rest is the treatment for the problem, right? So, if you kind of overdone it at a concert the night before and you were yelling and you're like, oh, I'm just going to take a little break this morning, push my singing practice out the afternoon, okay. But something that is kind of more of an ongoing problem, I think deserves being looked at, right? It could just be a little bit of voice overuse. You could have a polyp, you could have a hemorrhage, right? There's all kinds of things on there. So it's really hard to make one single recommendation about you should go on voice rest. I think that the other question I think I would have is, when should I come and see somebody, right? Like that is really, I think, the question. But you're never going to harm yourself by going on voice rest for a short period of time. But you want to make sure that things are getting better. And if they're not, you've got to come and see somebody just to let us check it out. And even if there's nothing down there, sometimes there are other things or suggestions that we can help with, easy stuff, right? So it may not mean that there's something serious or, big going on, but maybe something I can, could help with nasal drainage or, who knows what it might be.
I would love to piggyback on that question with Dr. Collins and say, so now the singer has listened to you and they have come in to see you or another laryngologist in the clinic, and you've done your exam, what are the situations, what are the results of that exam that would lead you to recommend voice rest for that person versus
I'll-
another path?
Yeah, I like that question. So I think, so a couple things. So if there's a hemorrhage down there, so if there's a bleed or a bruise under the vocal cord, that deserves voice rest, because clearly there's been some trauma, there's a leaky vessel, and we need to give that time to heal. So that needs voice rest. And that voice rest is typically about a week, and we keep really close eyes on you. There are other situations that also deserve voice rest. People can have ulcerations on their vocal cords, and that is a really serious problem, and requires voice rest for an extended period of time to allow the vocal cords to recover. And so that one also requires really close follow-up to ensure that there's healing. There's voice rest after surgery and those types of situations, but I think the more common recommendation is modifications in how we use the voice, especially for our patients that have really high vocally demanding jobs, right? So making some modifications for that, and maybe less so voice rest. Does that answer your question, Leda? Or do you have a follow-up?
I do have a follow-up, and not to hog the conversation here, but what do you think about, sometimes we have folks who come in and they have seen a doctor who told them they had nodules, and the doctor said, oh, you need to go on voice rest for 6 weeks or 6 months. What do you think about that?
I think that is bonkers. Just to be completely honest with you, I don't think there's ever an indication for somebody to go on voice rest for 6 weeks or 6 months. There's not anything physiologic that would support that, and the literature and the data just does not support that. To be completely transparent, there's not even a lot of data supporting the voice rest that most of us do after surgery. So I can't see that would make any sense. If somebody comes in with vocal nodules there, as opposed to putting you on voice rest, those, we got to address the underlying problem and get you back to life, right? Putting you on voice rest is just putting a pause on everything. And I don't think it's moving the patient forward in what they need to do, whether in their work, professional life, or, socially, or singers and their performances.
So Leda, if we see someone who comes into the clinic with nodules, for example, and voice rest is not recommended, how do you typically counsel them as far as how much they should use their voice, and what kind of tips would you recommend?
That's a great follow-up. Yeah, we kind of put all of this in a category that we call vocal pacing. So how much are you using your voice, how intensely, and in what situations? Now, a lot of times that refers to decreasing the amount of voice use and the amount of intensity for folks who have very vocally busy lives. So that would include singers, teachers, call center operators, attorneys, people in sales, anyone who just has to use their voice a lot for their day-to-day activities and likely their work. So in those cases, we want to try to find where, rather than saying, oh, you need to go on complete vocal rest, which, as Dr. Collins says, there's not really an evidence base for, and it's really practically very difficult, right? Oh, so I'm not going to go to work for a week, or I'm not going to, and talk to my children for a week. That's pretty hard. So rather than just voice rest, we're looking for where are there places where you can just have a little voice nap. Maybe 15 minutes here, 15 minutes there, and over the course of a day and a week, that can add up to some time for your voice to recover. Now, kind of circling back to where we started this conversation tonight, sometimes vocal pacing means maybe you're not exercising your voice enough. So going back to, say, I'm thinking about a specific patient I wrapped up with recently who's 83 and had a long career as a singer and a singing teacher, retired from her career using her voice less. Her husband passed away. She was using her voice less. So over time, just less and less voice use, and then was having a really hard time being able to sing. And that was something that, as Ingela said, really was her identity. So it was very painful for her to feel that loss. But But it really, in her case and in many cases, was just a question of getting that vocal exercise regimen back on track. And she's now singing with the community choir that she wanted to sing with when she first came in to see us. But it took kind of getting back on the, the exercise routine on a regular basis. Sometimes vocal pacing means bringing the load down. Sometimes vocal pacing means bringing it up. But it's all about finding that balancing point that your voice tolerates the best.
Switching topics slightly, thank you for going through that in so much detail. And I want to emphasize, as Leda mentioned, that it's very individually tailored. That's why it's hard to make a blanket recommendation. But when a patient comes in, we need to understand what the problem is with your voice, what you're experiencing, then take a look and see what's actually physically going on, and understand how you use your voice, what your demands are, what's bothersome about it, what your goals are, and then we can make recommendations tailored specifically for you. That makes it a little tricky to answer kind of blanket questions. Hey, what should I do when I experience hoarseness? Because there are so many things that go into it. And that's why having a specialized voice care team like we are is key, especially for high intensity, high demand voice use. We're talking a lot about singers today too, because most people who are attending our events and who are attending tonight are singers in some form or another. But all of the things we're talking about also apply to everyday voice users, people who just use their voices mostly for speaking, communication, work, public speaking, reading to their grandkids, fill in the blank. So don't feel, please, that just because you're not an official singer that you can't get voice care, you don't deserve voice care, and that voice care wouldn't be helpful for you. All these things we're talking about can be widely applied. We had a question come through talking about getting choked up when singing, and this person clarified that it's not so much about anxiety. They're not feeling anxiety when they're performing, but the song is emotional. They're trying to convey emotion, or there's something in there that just hits at their heartstrings, and they want to perform well, convey the emotion, but also control that to a degree where they can actually finish the performance. So I wonder if Ingela has any suggestions for that. I actually have that question too.
Oh, and sort of going off of what you were just saying, Lauren, so many of these things that it's hard to make a blanket recommendation because it's going to be rather individual to the person. I worked on this exact topic with someone fairly recently, so I had to put some thought into it. Any of us who have been to a wedding or a funeral or any type of event like that where a lot of emotion is present. I've had to sing at funerals before and at weddings, and I have to train myself to look away from the crowd a little bit, or to look over the tops of their heads, because we have something in our bodies called mirror neurons. So when there is a big emotion in the room, such as there is at a wedding or a funeral, and we see people around us who are choking up, who are feeling emotional, we pick up on that. We mirror the emotions of those around us. So, Lauren, you used the word control, and that's, of course, our goal is, can I control this? But control is also such a tricky word, isn't it? Because it assumes that there's something we can do, or something we can force into place, and then we will be able to do this thing as we want it to do. One of the questions I might ask a client that I was working with on this specific issue, well, first I would normalize it and say it is incredibly normal to get choked up, right, when we are feeling a lot of emotion. So much emotion resides in our voice. If you think about your nearest and dearest people, if you call them on the phone, you can usually hear within a word or two how their day is going, right? They don't have to tell you how their day is going. You hear the emotional state of your loved ones, or even others, right? Who hasn't gotten off the phone with a call center individual or somebody who you were calling at a doctor's office to make an appointment and thought, wow, it seemed like that person was having a bad day, just from their tone quality and what you could hear in their voices. So first and foremost, I would be curious to normalize their experience, and then also to ask them, what is it about this piece that you think makes you emotional, makes you choked up? Is it reminding you of something important from your life, of an important person? Really, sort of the therapist side of my brain asks, is there some grief or emotion that this person maybe hasn't fully dealt with in their own emotional healing journey that might be useful to delve into? But that doesn't necessarily have to be the case, right? We are emotional beings and emotion will be expressed through our bodies. I think if I were to give like the plainest, simplest recommendation or tip that I could, it would be to stop trying to control it, but to not have an antagonistic relationship with this event, but to accept it as part of something that happens. I know that if I were to see somebody singing and they started choking up and crying a little bit, my reaction would probably be to choke up and cry a little bit with them because I would be feeling their emotion so deeply. So I think we have to watch out because as performers, we oftentimes have these expectations of ourselves that we're some type of performing robot, that, normal human stuff shouldn't affect us. We should just get out there on stage every single day and knock it out of the park and only show emotion appropriately. But I think really just accepting that these things might occasionally happen and that the world will continue turning if they do. Honestly, even if it was for a really important event like an audition and you were to get a little bit choked up, well, the absolute worst that is going to happen is that you might not get that job. Who knows? But you don't know that. There's no way to prove whether that's going to happen or not. So I think what happens is once people start experiencing this, it's sort of like with a feeling of panic, right? That once someone has experienced this once, they go back to that hyper focusing that I was talking about before, where they go, oh no, what if this happens again? And they tend to fixate on it. And they tend to do what I call sort of heap pain on top of pain. So there's the original pain of the anxiety or the sad emotion that's coming up as we're singing. And then we're heaping more pain on top of it by abusing ourselves and saying, I shouldn't do this. And if this happens, it's terrible. And then we just go from there. And before we know it, we have this whole mess when really there is a part of this issue that is at the core that is truly difficult for us, but the sort of blaming and recrimination and the hyper focusing is definitely not going to be helpful in this case. So once again, I think it goes back to finding strategies to calm our nervous systems, to find ways of showing ourselves messages of love and support that even if this does happen, that's all right. And it doesn't necessarily mean it's a bad thing. Our brain loves to view things in black and white, says this is good and this is bad. But really, this issue is somewhere in the gray zone, because if we queried 100 people what they thought about a singer who got a little bit choked up, we would probably get, many variations of answers there.
Thank you all for kind of tangling with some of these questions that are simple on paper, but challenging when combined with, real live individual humans with different needs and different reasons. We had one more question come through asking about what we think of cough drops. And, might they cause other issues with like having to swallow more saliva, et cetera? So Dr. Collins, do you have any recommendations regarding cough drops?
Sorry, I'm here just a little bit delayed on my phone. Cough drops. So cough drops aren't necessarily bad. For our general recommendation from the Duke Care Center is to avoid cough drops or lozenges with menthol and eucalyptus. They feel good in the moment, but they can be more drying to your throat, lead to more irritation, more urge to throat clear, more urge to cough. I wouldn't say they're forbidden for somebody who doesn't have voice problems and uses lozenges here and there when they have a cold. It's probably okay, right? But when you have kind of ongoing irritation, probably something that we need to do away with. As far as the swallowing concern, so just generating more saliva, I can't think that would be. I can't explain a physiologic reason why that would be harmful or dangerous. So I think that that's safe to use. It's kind of no different than sucking on hard candy or taking sips of water regularly. The mechanism is the same. You don't want to rot your teeth out, so maybe choose a sugar-free version of cough drop.
So as y'all can tell, we could talk about voice things for forever, and there's so much to go into that we're still, even after many years of experience with all of us still learning about. the mystery of the voice and how to help people with voice problems, how to help people with performance anxiety concerns, medical concerns. So I'd encourage you to stay engaged with us. And if you would like to hear about future events, because we do singing focused events, we do a World Voice Day event every year, we do follow-up Q&A sessions on a routine basis, please reach out to worldvoiceday@duke.edu and let me know that you want to stay on the list. We will add you to the list. You won't get spammed too much, don't worry, but we'll let you know about events that are coming up. There's so much to cover. If you are, after hearing this discussion or after World Voice Day this year, thinking, you know what, maybe my voice isn't functioning very well for me. I wonder what's going on down there. Come see us. We have 3 locations throughout the Triangle. We're happy to see you. We want to see you. This voice is what we do. So we want to help you figure out what's going on and what we can do about it. And I think it's awesome to have Ingela's perspective here as well, because we're thinking from the medical side, what's happening with the vocal cords, how do we get the function to improve? But it's also important to keep in mind that our voices and minds and bodies are all connected and tied together, and what we do with one influences the rest. So I'm so grateful to everyone on the panel for providing your expertise and having a good discussion. It's always nice to end the night with even more questions. That means we can answer more of them in the future. So for any additional questions, or if you didn't get the World Voice Day recording, check your email that said, hey, sign up for this event, because the link is in there. If you don't see that, email us at worldvoiceday@duke.edu with that or any question, and we'd be happy to help you out. And maybe we'll see you in clinic at some point. Otherwise, happy voice using, happy singing, and take care. Thanks so much. Bye.